Hi, I'm Natalia from UNES Public Health Science Department. In this video, I would like to explain about helminth zoonosis, about schistosomiasis. Schistosomiasis, or bilharzia, is a disease caused by parasitic worms. It is caused by some species of blood trematodes or flukes in the genus of Schistosoma. The three main species infecting humans are Schistosoma hematobium, S. japonicum, and S. mansoni. Unlike other trematodes which are hermaphroditic, Schistosoma species are dioecious, which is individuals of separate sexes. And this is the life cycle of Schistosoma species. Schistosoma eggs are eliminated with feces or urine, and under the appropriate conditions, the eggs hatch and release miracidia, which swim and penetrate specific snail intermediate hosts. The stages in the snail include two generations of sporocysts and the production of the cercariae. Upon the release from the snail, the infective cercariae swim and penetrate the skin of the human host, and shed their forked tails to become the schistosomulae. The schistosomulae migrate via venous circulation to lungs, then to the heart, and then develop in the liver, exiting the liver via the portal vein system when mature. Male and female adult worms copulate and reside in the mesenteric venules, the location of which varies by species. This is the host for the schistosoma. For S. japonicum in cattle, dogs, cats, rodents, pigs, horses, and goats. It is endemic on China, Philippines, and Indonesia. S. mekongi in dogs and endemic in Cambodia and Laos, while S. mansoni in wild primates. It is act as a human parasite, but not a zoonosis. Endemic in Sub-Saharan Africa, Brazil, Venezuela, Suriname, Caribbean, and Arabian Peninsula. The infection occurs when skin comes in contact with contaminated freshwater in which certain types of snails that carry the parasite are living. Freshwater becomes contaminated by schistosome eggs when infected people urinate or defecate in the water. The eggs hatch, and if the appropriate species of snails are present in the water, the parasites infect, develop, and multiply inside the snails. The parasite leaves the snail and enters the water where it can survive for about 48 hours. Larva schistosomes or cercariae can penetrate the skin of persons who come in contact with contaminated fresh water, typically when wading, swimming, bathing, or washing. Over several weeks, the parasites migrate through host tissue and develop into adult worms inside the blood vessels of the body. Once mature, the worms mate and females produce eggs. Some of these eggs travel to the bladder or intestine and are passed into the urine or stool. Symptoms of schistosomiasis are caused not by the worms themselves, but by the body's reaction to the eggs. Eggs shed by the adult worms that do not pass out of the body can become lodged in the intestine or bladder, causing inflammation or scarring. Children who are repeatedly infected can develop anemia, malnutrition, and learning difficulties. After years of infection, the parasite can also damage the liver, intestine, spleen, lungs, and bladder. Most people have no symptoms when they are first infected. However, within days after becoming infected, they may develop a rash or itchy skin. Within 1 until 2 months of infection, symptoms may develop including fever, chills, cough, and muscle aches. Without treatment, schistosomiasis can persist for years. Signs and symptoms of chronic schistosomiasis include abdominal pain, enlarged liver, blood in the stool or blood in the urine, and problems passing urine. Chronic infection can also lead to increased risk of liver fibrosis or bladder cancer. Rarely, eggs are found in the brain or spinal cord and can cause seizures, paralysis, or spinal cord inflammation. Stool or urine samples can be examined microscopically for parasite eggs. The eggs tend to be passed intermittently and in small amounts and may not be detected, so it may be necessary to perform a blood test or serologic test. Safe and effective medication is available for treatment of both urinary and intestinal schistosomiasis. Praziquantel, a prescription medication, is taken for 1 until 2 days to treat infections caused by all schistosome species. No vaccine is available, so the best way to prevent schistosomiasis is to take the following steps if you are visiting or live in an area where schistosomiasis is transmitted. Avoid swimming or wading in fresh water when you are in the endemic area. Swimming in the ocean and in chlorinated swimming pools is safe. Drink safe water. Although schistosomiasis is not transmitted by swallowing contaminated water, if your mouth or lips come in contact with water containing the parasites, you could become infected. Bring your water to a rolling boil for 1 minute or filter water before drinking it to kill any harmful parasites, bacteria, or viruses present. Iodine treatment alone will not guarantee that water is safe and free of all parasites. Water used for bathing should be brought to a rolling boil for 1 minute to kill any cercaria and then cooled before bathing to avoid scalding. Water held in storage tank for at least 1 until 2 days should be safe for bathing. Vigorous towel drying after an accidental, very brief water exposure may help to prevent parasites from penetrating the skin. However, do not rely on vigorous towel drying alone to prevent schistosomiasis. Those who have had contact with potentially contaminated water overseas should see their health care provider after returning from travel to discuss testing. In countries where schistosomiasis causes significant disease, control efforts usually focus on reducing the number of infections in people and or eliminating the snails that are required to maintain the parasite's life cycle. For all species that cause schistosomiasis, improved sanitation could reduce or eliminate transmission of this disease. In some areas with lower transmission levels, elimination of schistosomiasis is considered a winnable battle by public health officials. Control measures can include mass drug treatment of entire communities and targeted treatment of school-aged children. Some of the problems with control of schistosomiasis include chemicals used to eliminate snails in freshwater sources may harm other species of animals in the water, and if treatment is not sustained, the snails may return to those sites afterwards. For certain species of the parasite, such as H. japonicum, animals such as cows or water buffalo can also be infected. Runoff from pastures, if the livestock are infected, can contaminate freshwater sources. So that's all my explanation about schistosomiasis. I hope you find it helpful and useful. Thank you.